So the topic of this video is effects of enzyme induction and enzyme inhibition. So what is enzyme induction? When two drugs are co-administered and drug 1 is an inducer of hepatic enzymes and proteins, there is increased metabolism of other drugs, thus reducing the concentration of the second drug, leading to a number of positive and negative consequences. So enzyme induction can lead to decreased therapeutic effect or therapeutic failure. Secondly, it can also cause autoinduction, leading to pharmacokinetic tolerance. Thirdly, enzyme induction can lead to a side effect. Fourth, drug toxicity can also arise from enzyme induction. Fifth, enzyme induction can also have beneficial effects, so it can produce therapeutic benefit. So how does enzyme induction reduce the therapeutic effect or therapeutic failure? So a drug which is an inducer of hepatic enzymes and proteins can increase the metabolism of the second drug, thus reducing the plasma concentration of the second drug, leading to decreased therapeutic effect or therapeutic failure. For example, barbiturates, which is an inducer of hepatic enzymes, increases the metabolism of warfarin when administered together. So increased metabolism of warfarin decreases the plasma concentration of warfarin, which has an anticoagulant effect. So this results in decreased anticoagulant effect, leading to decreased therapeutic effect or therapeutic failure. So next is autoinduction, which means is a drug which is an inducer induces its own metabolism, thus decreasing its concentration in the plasma, leading to the tolerance. For example, barbiturates will induce its own metabolism through enzymatic induction, thus reducing the plasma concentration of barbiturates, leading to pharmacokinetic tolerance of the effect produced by barbiturates. Barbiturates, which acts as a sedative or a hypnotic, produces pharmacokinetic tolerance, that is, it requires higher dose to produce the same therapeutic effect. Next is enzyme induction can also lead to a side effect. For phenytoin, which is an inducer, increases the metabolism of vitamin D, thus decreasing the plasma concentration of vitamin D, leading to vitamin D deficiency and osteomalacia as a side effect. Enzyme induction can also lead to toxicity. For example, paracetamol, when consumed in a normal healthy individual at normal therapeutic doses, undergoes metabolism through glucuronide pathway, which is the predominant pathway, and cytochrome P450 pathway being the minor pathway. Now, when the normal individual is overdosed with paracetamol, the glucuronide pathway gets saturated. So this leads to the activation of cytochrome P450 enzymes, leading to increased metabolism of paracetamol, leading to the formation of a hepatotoxic metabolite, that is para-benzoquinone, which causes hepatotoxicity. Ethanol is an inducer of hepatic enzymes. So it induces the metabolism of paracetamol. Increased metabolism of paracetamol leads to saturation of the glucuronide pathway, leading to the activation and diversion of cytochrome P450 pathway, thus increasing the concentration of hepatotoxic metabolite, that is para-benzoquinone, leading to hepatotoxicity. Thus, paracetamol in normal individuals causes hepatotoxicity when overdosed, but in ethanol drinkers, it can cause hepatotoxicity at normal therapeutic doses. Enzymatic induction can also produce therapeutic benefit. For example, phenobarbital is useful for the management of neonatal jaundice. Phenobarbital can be given to the pregnant mother 7 to 14 days prior to labor or to the infant soon after birth to induce fetal hepatic glucuronal transferase enzyme, which conjugates bilirubin to bilirubin glucuronides. Bilirubin glucuronides, which is a conjugated form of bilirubin, is excreted in bile. This leads to a reduction in plasma concentration of free bilirubin, thus reducing the incidence of neonatal jaundice. Next is effects of enzyme inhibition. So what is enzyme inhibition? When two drugs are co-administered and one drug is an inhibitor of hepatic enzymes and proteins, it inhibits the metabolism of the second drug, thus increasing the concentration of the second drug in the plasma. So the drug stays in the plasma for a longer time, producing beneficial and negative consequences. So what are the beneficial effects of enzyme inhibition? For example, levodopa when administered with carbidopa is useful in the management of Parkinson's disease. It is known that levodopa is converted to dopamine in the periphery in presence of dopa decarboxylase enzyme. Dopamine is impermeable to blood-brain barrier, so it is not able to permeate the blood-brain barrier or reach the brain. Also, there is decreased availability of levodopa for entry into the brain. Carbidopa when administered along with levodopa is an inhibitor of dopa decarboxylase enzyme. So inhibition of the enzyme prevents the conversion of levodopa to dopamine, thus increasing the concentration of levodopa in the plasma. So increased concentration of levodopa increases the penetration of levodopa into the brain, and levodopa is converted to dopamine in the brain and is available for action and is thus useful for the management of Parkinson's disease. Thus, levodopa when administered together with carbidopa increases the therapeutic effect, increases the T-half of levodopa, and also reduces the side effects of levodopa. So next example is disulfiram used in the management of alcohol de-addiction. Alcohol gets converted to acetaldehyde in presence of alcohol dehydrogenase enzyme, and acetaldehyde gets converted to acetate in presence of aldehyde dehydrogenase. Thus, disulfiram treatment in alcohol drinkers inhibits the aldehyde dehydrogenase enzyme, leading to accumulation of acetaldehyde in the plasma. Accumulation of acetaldehyde leads to unpleasant signs and symptoms of headache, nausea, vomiting, palpitation, sweating. This leads to aversion of alcohol due to accumulation of acetaldehyde in the plasma. So disulfiram is very useful for the management of alcohol addiction. The next example is neostigmin reverses neuromuscular blocking action of tubocurarine. For example, tubocurarine is a competitive neuromuscular blocker. It competes with acetylcholine and binds to the NM receptor at the neuromuscular junction. So after the completion of the surgical procedure, neostigmin is administered to reverse the neuromuscular blocking action of tubocurarine. Neostigmin inhibits the acetylcholinesterase enzyme, which is responsible for the degradation of acetylcholine to acetyl coenzyme A and choline. So, by inhibiting the acetylcholinesterase enzyme, there is increased accumulation and increased concentration of acetylcholine in the plasma. So, increased concentration of acetylcholine displaces tubocurarine from the NM receptor at the neuromuscular junction, thus reversing the neuromuscular blocking action of tubocurarine. The next is, what are the adverse consequences of enzyme inhibition? For example, theophylline when administered with chloramphenicol, chloramphenicol being an inhibitor of hepatic enzyme increases the plasma concentration of theophylline, and small increase in plasma concentration of theophylline can lead to adverse consequences such as nausea, vomiting, severe side effects, and central nervous system side effects. The second example, terfenadine when administered with chloramphenicol. So chloramphenicol is an inhibitor of hepatic enzymes, thus increases the concentration of terfenadine, and this leads to precipitation of cardiac arrhythmias. So the next example is phenytoin when administered with chloramphenicol. Phenytoin toxicity can result due to enzyme inhibition caused by chloramphenicol. So this is characterized by severe ataxia and other signs and symptoms. So next example, warfarin when administered with cimetidine. So cimetidine, which acts as an inhibitor of hepatic enzyme, increases the concentration of warfarin, and warfarin has a narrow therapeutic safety margin. So Small rise in the concentration of warfarin can lead to increased risk of bleeding and increased anticoagulant effect. Morphine, when administered with MAO inhibitors, by inhibiting the MAO enzymes affect the metabolism of morphine, so thus increasing the concentration of warfarin, leading to respiratory depression and respiratory failure.
These are my references. Thanks for watching. Please like, subscribe and share.